Hi, this is just a brief update of what's happening and what's changed recently. My surgery has been postponed by a few weeks. This is because I needed to get some dental work done. One of my teeth had some trauma. Filling was replaced and the replacement filling was loose, and the filling was quite close to the nerve anyway. When the filling got replaced, that was quite that was trauma to the nerve. So the nerve died. I did try valiantly to save it. I had laser treatment on the tooth to try and revitalise the nerve and the pulp that surrounds it, but unfortunately it wasn't successful, and because of that I need root canal therapy for the tooth, which is not massively pleasant, but far better than I thought it would be. I've had the first bit done a couple of yesterday, in fact, I think, which involves kind of opening up the tooth and removing the nerve. In my case, there was no infection or anything, so when a nerve dies in the tooth, it can be because of an infection, kind of decay, or it can be trauma, like you've been punched in the mouth or something like that. Or, in my case, kind of a deep filling being replaced and then that replacement filling having to be replaced. So I had to get the root canal sorted out before the surgery, because if you leave a dead nerve in your tooth, then the tooth can get, or the tooth will, I believe, get infected, generally will get infected. And if the infection kind of spreads to the rest of your jaw, it's extremely serious. Having to have teeth removed and bits of bone cut out and stuff, it's not nice. So that had to be done before my surgery, basically, and in Japan dental work takes a long time. It's kind of spread out over a period of weeks because the government don't pay the dentists enough and don't pay properly for the national health insurance to the dentists, so they have to spread the treatment out over several weeks, which is very frustrating. So I think what the dentist is going to do is finish the root canal, but just put a temporary kind of resin cover or something on the tooth, and then after the surgery I'll have to have that removed and replaced with a crown. So if you have root canal, I think in the front of your mouth, you can essentially get away with having like just a filling essentially put in after the dentist has sucked out all the inside of the tooth and filled up with a hard resin. But if it's kind of mid-teeth or back teeth, because you grind on them, you need something stronger, which is why you need a crown. So it's a hassle, it's very frustrating, but anyway, so my new surgery date is the 12th of July, which is in fact a month from now. Because of delaying the surgery and because my pre-surgery checks were sort of a month and a bit before my original surgery date, I have to do my pre-surgery checks again. So beginning of July I will do, I don't need to do the CT scan or the endoscopies fortunately, but I'll take chest x-ray and some blood tests, like the clotting blood test to make sure that my blood is clotting okay, and full count blood tests, so white blood cells, that kind of thing, liver function, and ECG, the electrocardiogram, to check my heart is okay for surviving surgery. It won't be hugely surprising if my surgery gets postponed again. On Monday, I met with a surgeon and I had a blood test, and the blood test result was the worst it's been for kind of 6 months. So for the past 6 months, I've basically been waiting for my platelet count to rise. Platelet count is important for good healing after surgery, and mine rose a bit and now it's been falling again. So that's a real concern. The surgeon says he is prepared to do the surgery even if the platelet count's pretty low. The reason for that is in my case, the concern about a low platelet count is that it could indicate poor liver function. So most of your platelets are made in your liver. I believe some are made in your bone marrow as well. And it looks like I have a slightly enlarged spleen, and that could be causing the low platelet count, which means my liver is hopefully working okay and making enough platelets, and just the spleen is destroying them. The other parts of the blood test on Monday kind of indicated that my liver function was okay, so the surgeon's okay to go ahead with the surgery as long as the platelet count isn't like much worse on the day of the pre-surgical checks. Another really quite major thing is that I have asked the surgeon to do the surgery in one step, not two. This was a very, very, very tough decision, and it's causing me a great deal of stress and anxiety. Doing the surgery in one step. So I don't really mean one step. I mean doing just doing one surgery and then that's it. Usually, at least in Japan, this would be done as 2 surgeries, and that's because in the first surgery they put some extra steps in to give you a temporary ileostomy on your small intestine. So that means making a hole in you, putting out some of your small intestine through the hole, cutting into the side of the small intestine, and then putting a plastic bag there that needs to be emptied throughout the day. And you are you deal with that plastic bag for maybe up to 6 months, and then you about 6 months later you then have another surgery to undo that temporary ileostomy. The reason for this is not to decrease the risk of a leak when your intestines are reconnected. Because it doesn't, it's not clear that it does decrease the chance of a leak. The reason for this, that if there is a leak, then it's not particularly dangerous because you have no waste passing through that bit of your intestines. So why would I ask for the more risky surgery, I guess, doing just one surgery, not making a temporary ileostomy on the small intestine? and just reconnecting my intestines and hoping that there's no leak. You can see my daughter there just in the background sneaking through. And why would you want to do something more risky? Because if you do it as a single surgery and there's a leak, percentage of the risk of a leak is generally about 10%. In my case, it might be a bit higher because the blood supply to my large intestine is probably poor because some of the blood supply there was cut away by the previous surgeon who made the colostomy. And the distance that the large intestine has to stretch is quite far. If your large intestine is under tension when it's joined up, that's another risk factor that causes leaks. If you do have a leak after just doing the single surgery, it's extremely serious and you have a very, very high chance of severe permanent side effects. So the reason I'm taking this very big risk and asking the surgeon to do this surgery that he doesn't really want to do, he strongly recommends to do it as 2 surgeries. It's much more difficult for him and the team to do it as 1 surgery because although they're doing less surgery in that 1 surgery, they're doing considerably less surgery. They're going to have to be ultra careful and take every possible precaution for there not to be a leak. So the reason I'm doing it is because if you do it in 1 surgery and if there is no leak in the intestines, then the recovery time is much shorter than doing 2 surgeries. So with 2 surgeries, you do the first surgery where your intestines are reconnected and the temporary ileostomy is made on your small intestine. And then typically 2 to 4 months late, typically 4 to 6 months later, you would have the second surgery. In Japan, it's often to be 6 months, so 6 months of a temporary ileostomy. Then you have the second surgery. Then the very tough recovery starts from then. It doesn't start from the first surgery, it starts from the second surgery, where you're trying to regain control of your intestines, basically. And because your large intestine hasn't been used for 6 months, it stopped working, really. So you have a lot of troubles generally for a couple of years, sometimes longer. If you did 1 surgery, then you start recovering straight away. And I should say that if I have it in 1 surgery and everything is very successful, quality of life is still potentially quite bad afterwards. There's no full recovery. I mean, when I say recovery, it's kind of some recovery and some lifestyle changes about when you eat, what you eat, how much you eat. Getting to a point where life is bearable after some months. If you do it in 2 surgeries, then you're getting to the point where life is bearable after potentially a couple of years. So the difference is huge, and it would be very over-optimistic for me to believe I'm going to live 2 years from today. That's kind of fantasy at the moment. It'd be wonderful, and I'm going to try extremely hard to live for another 2 years. But yeah, that's not really realistic at the moment. And to do 2 surgeries and basically have another 2.5 years of really poor quality of life. Yeah, I can't take that risk. That's not a sensible course of action. So I'm asking the surgeon to do an incredibly difficult surgery. I mean, doing it as 2 surgeries in my case is still difficult. The second surgery is relatively straightforward, but the first surgery is, it's severe because of how much of my intestine was removed and other stuff removed, and because I've had 4.5 years of chemotherapy out of the past 5 years. So I had sort of 6 months break after liver surgery, and because this is my 3rd abdominal surgery, and because I've done so much radiotherapy, this surgery is going to be difficult, extremely difficult for the team. So that's the main thing that's happening now. Perhaps ironically, recently I've been feeling physically very, very good. I've been off chemo for quite a while now, quite a few months. In fact, about 6 months, I think. This was to hopefully this was going to raise my platelet count. That hasn't happened, but feeling good, being off chemo, and particularly being off chemo has allowed me to do some, very moderate exercise, which to me, after battling with terminal cancer for 5 years, is actually a huge amount of exercise. So that's really great. It's incredibly difficult to do real exercise when you're on chemo, because starving your body of oxygen all the time. Chemo destroys your red blood cells that carries some chemos rather destroy red blood cells, and the chemo just has a lot of side effects that make it very difficult. Particularly, I was on a drug with the chemotherapy called Avastin. I think the generic name for that is bevacizumab, and that stops your body healing. So when you're just doing even moderate exercise and you're getting the micro tears in your muscles that usually would start healing the next day, that kind of thing is a real problem. So I've been able to do some exercise. That seems quite tough for me, but is kind of embarrassingly feeble. Going up found some good steps in my neighbourhood, so going up and down steps with very, very light ankle weights on and stuff. So this is preparation for the surgery. It's really important that I strengthen up my lungs a bit to try and prevent the pneumonia after the surgery, which I had after my liver surgery and the first surgery that made my colostomy 5 years ago. I've been losing quite a bit of weight recently, so again that's difficult and to do on chemo, and probably is not a good idea. It's very, very difficult to say. The research is not particularly convincing about the weight you want for chemo. Anecdotally, for all the patients I've talked to, they say having extra weight is good, within reason obviously, for chemo. the nurses who have a very good sense of how people survive cancer, yeah, they sort of say, keep the weight up if you can. Often with chemo, it's hard to maintain anything like a healthy weight because you may be vomiting a lot. It can be really, really, really difficult to eat with chemo. You have chemo that causes really painful mouth sores. I took a chemo called oxaliplatin, which is a platinum-based poison, and you get damage to the nerves in your mouth. You get this bizarre thing called first bite syndrome, where when you first bite into food for quite a few days after the chemo, it's it's not painful. It's like a little lightning shocks going into your brain. It's unpleasant and scary. The most famous thing about oxaliplatin is hypersensitivity to cold for your mouth. So you might just room temperature water might be okay, but anything cooler than that can be really painful enough. Since I stopped all that kind of chemotherapy, still eating is kind of quite unpleasant with just the more milder chemotherapies I'm on because you're just feeling sick all the time. And anyway, so I'm now, I've been losing weight for the surgery. Up till now, I've been losing weight from eating less and eating lower calorie foods. But for these last few weeks, I have to mainly lose weight through exercise, it is better to mainly lose weight through exercise. Now, generally, losing weight through exercise is incredibly difficult. And there's all the research. It's way easier to avoid eating something, eat less, or eat low calorie foods. The reason I'm doing that is that when you eat less, your body tends to lose fat from the outside. When you exercise hard, proper exercise, you tend to lose weight from inside what's called visceral fat. And it would be very helpful if I could lose some visceral fat. The reason for that, so visceral fat is the kind of the fat that surrounds and protects your organs. And the more visceral fat I can lose, the more space the surgeon will have to work in, and the less chance of complications and leaks. So for this kind of surgery to reverse a colostomy, men tend to be at quite a bit higher risk of complications than women because the male pelvis is kind of narrower and deeper. Women have a kind of the wider, shallower pelvis. So there's not a lot of space in there to begin with. And if you can imagine, you having like extra fat around the organs is not good. So that's why I am doing my feeble exercise as much as possible. So the really weird thing is, for the first time in 5 years, I'm kind of feeling a little bit like myself, which is just so weird. We kind of realise how tough it's been over the last 5 years on chemo and stuff. Of course, after the surgery, I'm going to be back in a much worse shape again because I'm looking at 3 to 5 weeks in hospital, and the beginning of that mainly in bed, and coming out of surgery, I mean, leaving hospital, it's going to be very, very tough initially to eat anything. You're often recommended I think it's the Bram diet: bread, rice, something called applesauce, which I've discovered is an American food product, and it's like a jar of applesauce. I'm not sure why you wouldn't get some apples and make your own applesauce. We have applesauce in England, but I think it would be a bit strange to go to a supermarket and buy it in a jar. And the M is for mashed potato. So the Bram diet is what you use on for quite a while. And after the surgery, I have to kind of work out how to walk again and stuff. So I've been told if I do the single surgery, then the first few days will be no food at all. After surgery in a hospital, it'll just be having nutritional drips, and then there's like a week of liquid food. So in Japan, that means this stuff called okayu, which is like rice. It's like a rice porridge. In Cantonese, I think it's called congee. So kind of rice cooked with extra water and maybe some, I guess, some kind of stock. So in Japan, they have to use dashi, which is usually fish stock made with bonito fish, I think. Katsuobushi in Japanese. And so you have like a week of liquid food while your intestine kind of heals, and then slowly introducing solid food with lots and lots and lots of restrictions. So that's where I'm at the moment. So first thing is get the rest of the tooth work done. So I'm going on Monday. That will be to check if any infection has developed since the dentist removed the dead nerve from the tooth and kind of cleaned out inside, and then have some kind of temporary cap put on that. Pre-surgical checks beginning of July, so I shall update you then. And yeah, I may be kind of weeping and heartbroken if the surgery gets postponed again, but we shall see. As always, thank you for the incredible support and interest. The YouTube comments are always fantastic. They mean a lot to me, and many of them are also very helpful. The practical advice you've all been giving me. So yeah, that's fantastic. And if you can donate, that is massively appreciated. Having this surgery means there's a big chance of cancer growth afterwards, because having the surgery weakens your immune system a lot initially, and also because as your body's healing, cancer hijacks the growth of the wound healing process, and it's a chance for cancer to grow and spread. So that's why I'm trying to get the money together for immunotherapy afterwards. So I can do the surgery and then have some immunotherapy that will reduce the risk of more cancer appearing. My recent scans, no cancer has shown up. So that means that there's possibly many tumours that are too small to see on the scan, and also cancer floating around in the blood, but no big visible tumours that can do a lot of harm. So that's really good news so far. Okay, thanks a lot. Please share my fundraising link if you feel comfortable doing so, because it makes a huge, huge, huge difference. And please subscribe to my videos. Thanks a lot. Bye.